extending our warmest greetings to the people tuning in. We are so excited to introduce you to our guest for the day, Dr.Theertha Shetty. She is an obstetrician and gynecologist working as a consultant in Mumbai, Maharashtra. A gynecologist by training, she has a keen interest in research, minimal access surgery, lactation support, and believes that healthcare should be non judgmental and accessible to all. She believes knowledge empowers and loves sharing information on social media for creating awareness amongst one and all. Doctor, is there anything else you would like to tell our listeners about yourself?
Thank you so much for that elaborate introduction. And I'm glad that we are having this conversation today, which was only a dream maybe 15 or 20 years back. And I am so happy that Girl Up Shisha is taking up this initiative of creating awareness and providing a platform for not just others as well as doctors like me, wherein we can dissipate the information and the knowledge that we have so that we can benefit as many as possible. So yeah, I just want, put forward my thank you for all that you guys do.
That's wonderful. Thank you so much for joining us today for this podcast, ma'am.
Thank you for having me.
So, the topic for today's podcast is about pregnancy, the taboos associated with it, and the ins and outs of the whole cycle. Let's start with the most basic question. How does the environment of a pregnant woman affect uh, affect her in all her different directions, like emotionally, socially, physically, etc.?
Okay, so let me start with the basic, like you said. Pregnancy, a human being is trying to grow another human being. Uh, your body is going to take a 360-degree turn, wherein she's trying to keep another human being alive, that baby alive. The baby is going to be nourished, the baby is going to grow, and she's trying her best to keep the baby healthy. So that takes part of the physical aspect. Like she's going to gain everywhere. She's going to gain in kgs. She's going to have extra weight carrying forward. Then comes the hormonal bit. Her hormones are going to shoot. Estrogen is going to increase. Progesterone is going to increase. Relaxin, there's another hormone which causes relaxation in all the joints, all the tissues to allow the pregnancy to be comfortable. There's prolactin increasing, to name a few. So the hormones are all over the place. That takes part of the emotional bit. Now, so when it comes to the social aspect, what I have seen or experienced over the number of years is, for some reason, whenever a woman conceives, it is just taken for granted that whatever task she is doing or whatever job she is doing, she will not be able to. It is just assumed that she will not be able to do it to the optimum limit, or she will not be good at it anymore. Just assumed without even asking her. Like, have we ever asked her whether she's going to be able to do it or not? We never let the woman decide whether she is going to be able to complete her job, whether she's going to be able to meet her deadlines. So without even giving her that benefit, we just assume. So she is going through a lot. You have to remember that a pregnancy is not just a woman, it's the entire family. Everything is going to change in her life. So we never start from the basics. Basic includes just asking the woman, how is she doing? She's going to, first trimester is all about morning sickness, it's all about heartburn. She has to wake up, she has to, if she has another child, she has to take care of the child, she has to take care of her own needs, then she has to take care of the needs of the family. As a society, what we should do, the pregnant person will never ask you to do any magnanimous tasks for her, just basics. Asking her if she ate, if you're a family member of somebody who's pregnant, asking her if she's had her meals, if she's working from her desk, keeping a bottle of water, keeping something for her to munch on, just asking her how was her day. If you are in working with somebody who is pregnant, probably just asking them if there is something that they need help with, if they want you to share the responsibility, if there is some project they're working on and you can do some task for her, please go ahead and do it. Or just asking her if you can accompany, if the woman's partner is not there to go with her, if you want her to be accompanied to the hospital visit. These are all little things that we can do as a society to help somebody who's pregnant, to make it comfortable for her. I will not say a joyride, but at least make it as comfortable as possible. So these are the little things that we should just take care of. There's nothing big needed. This is very basic.
Ma'am, so you talked about how we take like we just give up on the fact that she's a working woman, or she has a job and she has a personal life besides the family and the pregnancy. And nowadays a lot of women are in positions of power at workplaces, and that obviously comes with a stress baggage of its own. How does I would say her professional life get impacted and plays a role in the pregnancy? Like, does are there any cases where a lot of burden in the professional life affects the pregnancy in a negative way?
See, that's what I'm trying to tell, that even if the stress might not be affecting her, we keep telling her that, oh, you're pregnant, oh, you're pregnant, are tujhe kaam nahi hoga, are you will not be able to. Those there are very snide comments, some co-workers saying, अरे ये तो pregnant है, अभी तो ये maternity leave पे जाएगी, अभी तो ये नहीं होने वाला है उससे. So apart from the stress of the workplace, there's stress from the society. So negative impact is mental, like health is not just this has been now brought into focus, that health is not just physical or emotional health, even mental health. You have to be strong enough to carry, like I said, you're growing another human being. It is no mean task. And to carry it to term, we as obstetricians we have a goal, which is healthy mother and healthy baby. Everybody is focused on healthy baby, but if the mother is not healthy, even up here mentally, how will she be healthy otherwise? So the stress in at workplace is not just the deadlines, or if you're an obstetrician, the stress of giving proper healthcare to other patients. Even if you're pregnant, I have seen women who have gone through 9 months without any trouble, but stress can affect the growth of the baby. You might not eat well, you're sad, those things affect you, these things. And eating well is any day, always the what is called, put in inverted commas, when you're pregnant, because you have to eat a certain number of calories to ensure that you are gaining weight and your baby is getting nutrition. So stress can cause fetal growth restriction, it can cause your BP to rise, and then comes the sequelae afterwards. So like I said, stress is not just work stress. Stress is overall that stress that she gets from the society, which has to be worked on. Just leave her alone. There's so many remarks that are passed, so much advice that is given. We have to remember that every pregnant woman is different. So let her manage her pregnancy the way she wants. If she needs your help, give her an atmosphere where she can openly ask for your help, so that she's not hesitant enough to ask you for it. Be it her family member, be it her co-worker, be it her partner, be it her in-laws, be it her own parents.
So nowadays we have seen a term called husband stitch coming up frequently again and again. Could you please elaborate on that?
As soon as you said husband stitch, Arav had this sly, smile one-sided.
Yeah, I could see something going on between you two.
Yeah. So, you know, actually, honestly, husband stitch was, I read it some time back when I was reading obstetrics, and I had forgotten. So,
Hmm.
for all those who are hearing or watching, husband stitch is this additional pair of sutures that are placed, after the woman gives birth. We have to repair the perineum or the vagina from where the baby comes out. Sometimes there's a tear, or we give an additional cut, which is called the episiotomy, to kind of widen the birth canal so that the baby can slip out. So when we repair that tear, husband stitches putting an additional pair of sutures, which was thought to be an attempt to tighten the vagina or tighten the perineum, which is for sexual pleasure. Now, whoever has the name itself, husband stitch, whoever devised that term, I will unabashedly say that must have been a misogynist who just believed in objectification of women. So there's no evidence of any benefits of it whatsoever. In fact, it will only give discomfort and pain to the person who receives it, and she's already in so much discomfort. Why you want to add to it? There is no evidence of any benefit whatsoever. So anybody, asking for it or promoting it or whatever it is, should just not do that. Do not do that.
Ma'am, so we've touched upon the topic of husband stage, and a recent Bollywood movie called Dr. G talked about how a male medical student comes into the Department of Gynecology, and in that movie there is a particular scene where the concept of husband stage is talked about,
Mhm.
and it is basically shown that the husband requested for it, like the
Hmm.
husband told the wife to get that done. So,
Hmm.
can we believe that this is all very male centric? And I mean, does it actually have any effect on the pregnant lady? Any benefit? You said that there is no benefit whatsoever. So, is it just that mentality or a misogynist thought that is there in the husband, that he prefers a husband switch?
So, from what I read from all the articles the limited number of articles that are there, they're usually devised to supposedly increase the pleasure for the husband. That's what I have read about. Also, yes, it's male centric because, and it's not put in the pregnant woman, it is put after childbirth. I
Yeah.
mean, the vagina is a flexible organ. After 6 weeks, it's going to come back to its original shape, size, everything. This whole point, let me make this very clear, that the vagina will not become loose. This whole point that it becomes loose after childbirth is false. Your vagina stretches to let the baby pass through, and then it comes back. Just like all the organs of the body of a pregnant woman, they increase to various sizes. Your uterus increases to almost 10 times its size. So in 6 weeks, when as the uterus, your kidneys, everything is going back to its pre-pregnant state, the vagina will also come back to its pre-pregnant state. So husband stitch is absolute BS, if I have to be very, very clear and very clear about it. So, your vagina, the husband stitch is not required, not necessary, and medically, so definitely not recommended. So, obviously, it is just a popular term which is just being circulated unnecessarily.
All right. So currently, the maternal mortality rate is 97 per lakh live births. And thanks to healthcare infrastructure, it has been declining if we compare it to the past data. But the gap between rural and urban maternal mortality rate is quite huge. Could you please elaborate on that once?
So, I went back and I was going through all the data that was there. The one of the primary reasons why it is more in the rural areas is probably because of home deliveries being quite prevalent in the rural areas when compared to the urban areas. That is one of the primary reasons. Other reason would be that people don't come forward and access the healthcare that is being provided. However, we've gone leaps and bounds. Just like you said, we've come down from a 3 digit to a 2 digit, which is 97, which is
Hmm.
extremely good. So, but still, the number of institutional deliveries have increased from probably 80 from 79% in 2015-16 to 89% in 2019-20. Just imagine 89% of women are delivering in institutions, which is excellent for our country. And out of that, 94% were from urban areas, while 87% were from rural areas. So we're still catching up, I think, but there'll be a point where we'll be at par, and probably the rural areas and urban areas will be at par with each other. So yeah, this is one of the main reasons is many women still deliver at homes without a doctor, those dyes and people at home deliver them. That is the reason why we are having that gap.
Okay. So, like as you mentioned, that a lot of women in rural areas prefer to or have to give birth in their homes. So, to tackle this problem, what are some government schemes that have been brought up or implemented to help pregnant women?
Okay, so from I passed out in 2017. That time, what was just introduced was, I'll start from the basic, anemia mukt Bharat. Anemia is extremely prevalent in our country. There was this ad. There was a very fancy lady singing a song, Sona Lele, something something. There is one ad which was very prevalent that time for anemia mukt Bharat, and I am so happy with the way the present government, or our government is using social media, or be it television ads, to promote healthcare. So anemia mukt Bharat is basically targeting anemia right from childhood, which includes deworming, given iron supplements right from children, so that we target anemia in childhood, adolescence, so that she doesn't enter pregnancy with low iron stores. That is one. So that is from childhood. Then we have something called as Pradhan Mantri Surakshit Matritva Abhiyan. So that is, which is an excellent initiative wherein they have included, or they have roped in, private sector doctors, and you are provided comprehensive and quality healthcare checks on the 9th of every month. That will include your blood test, your urine test, your checkup, your supplements are given free of cost. Your tetanus toxoid injections, which are supposed to be given during pregnancy, is given. You are provided with an ultrasound, and women are motivated to come and access this healthcare. That is one program. Apart from that, next comes the nutrition bit. There's something called as Poshan Abhiyan, wherein mothers are given free meals, and they have gone down to the panchayat level. They have something called as a Poshan Ma, which is celebrated in September every year, from the 1st to the 30th of September, if I'm not wrong. And they have roped in the panchayats to celebrate this Ma, which is, Ma means month in Hindi. So there's something called as Panchayat Ma. So mothers are given free meals. Apart from that, there is something called as Pradhan Mantri Matritva Vandana Yojana, wherein the mothers are given monetary benefits, direct bank transfer of X amount into their account, so that they can be compensated for their partial loss of their wages. Then the next is something called as Suman, which is Surakshit Matritva Anushasan, and Lakshya, which is labor room and quality control initiative. Now there is something called as, there were two programs which were initiated by the government long back, which is Janani Suraksha Yojana and Janani and Shishu Suraksha Yojana. So these are extensions of the same, wherein the mothers are provided with respectful and dignified delivery services, and absolute non-tolerance to refusal of services in the public health sector. Like, no mother can ever be refused from any public health sector hospital, so that she gets to deliver in a institution. Laksh, which is labor room quality control initiative, that takes care of quality control in the labor room, in your operation theater, intensive care unit, as well as high dependency units. Now, apart from that, they have also tried to include something called as mother and child health wings. There are birth waiting homes. This is still in the beginning stages. Now, these are for the institutions where there is a high caseload. So if the mother is waiting in like early stages of labor, they have created these homes where they can be waiting for their birth. And the next is Matritra Suraksha Ashwasan. Now the next target is to bring down that maternal mortality to less than 70 per lakh live births, and I hope we achieve that very quickly, considering the way we are going. So the government is working very hard.
That is really good to hear, ma'am. Uh, so we've talked about the things that happen during pregnancy, and one of the major things that we see and we notice here and there is that post-pregnancy care for the mother especially is often neglected, because once the child is born, all attention is diverted towards him or her, and what we don't sometimes realize is that the mother is equally delicate at the time. So how important is post-pregnancy care for the mother, and what are some ways to do it?
Okay, see, childbirth is very rewarding, but also traumatic. If we go to say, the insides are being torn apart, the child is being born, all of a sudden your hormones go crashing, you've just given birth, you're exhausted, you're sleep deprived, everything. So now you never know what the mother is going through. There might be an array of emotions that are going through the mother. The last thing she needs is, being bombarded with your physical presence and being given advice which she might not even asked. Or it could be the other way around. She might want people around. She might be feeling lonely and she wants people around. What is most important is after the delivery, please ask the mother. It's always the in-laws that are asked. Ask the mother whether she wants you to come, whether she is welcoming relatives at that point. I've seen it in the hospital. The baby is born. It's such a happy atmosphere. Everybody is just like, I want to see the baby. I want to see the baby. But there is another human being. There's another person from whom that babies come out who might not be wanting to meet anybody. So please ask the mother what she wants. If you are a pregnant woman or a new mother listening to this or watching this, please prioritize yourself. This is what I tell everybody whom I meet. Prioritize yourself, you and your baby. She has to wake up every 2 hours to breastfeed the baby. There is pain. She might be constipated. There might be a catheter, for the urine to pass. She might be having so many issues going on. She is still trying to learn. She's still trying to cope. The baby is born, the baby is pulled out of it's quite secure inside the amniotic bag. Suddenly it's brought out into the light. There is light, there's sound, there's so much of noise around. So they say, keep the baby close to the mother's chest. That's what you say, skin to skin contact, so that the baby's breath and the heartbeat is regulated. The same thing is happening to the mother also. All of a sudden, so many things are happening. She has to learn to breastfeed. Nobody is born a mother. They have to learn everything. They're learning everything. They're learning new things every day. In between that, if somebody comes in and just, like I said, passes a snide remark, oh, you don't have milk, it might just be a normal statement for some, but it does impact or affect mental health of some mothers very badly. Like, oh my God, why did she say that? And overthinking, things like that. So post childbirth, always I keep telling that, please ask the mother if she wants you to come. If she doesn't want you to come, let her take her time. Let her, she might not be wanting to see you. Let her take her time, take it slowly, and let her do as she wants to. And for the mothers, it's okay to say no. If you're not comfortable with something, please voice it out. Nobody is going to, you don't have to be the good girl all the time. Good girl, if you're not comfortable, just say it.
Wow, it's a dimension that I really never thought about until up until now. Now that you mentioned it, that really we don't ever ask the mother that, do you want us to be there to be present, or do you just want a closed ones there? I mean,
Also only get things for the baby, if you've noticed. You should
yeah,
always ask mother what she wants to eat. Is there any comfort
yeah.
food? Take that for her. If you want to like be there for her, take the comfort food, leave it in her room, and just be like, whenever you're comfortable, eat. She'll be happiest. I'm sure any mother will love to eat whatever she wants post childbirth.
Um, the role of men has now completely changed with respect to pregnancy. We've all seen this phrase being used, we are pregnant, as well as paternal leaves are now becoming a very common thing. So, how has this global scenario impacted India, and what are some positive changes that can now be witnessed?
So paternity leaves were not popular earlier because nobody used to ask for them. Nobody used to take them. And again, we always discuss or comment about how patriarchy affects women. We never discuss
Mm,
about how patriarchy affects men as well. That whole such a mean thing to say, man up. Why
yeah.
why do you have to man up? And even the paternity, even when a famous cricketer, I will not name the person, was had brought up that topic of paternity leave, there were trolls, like, I mean, innumerable trolls. Why can't the father be there for the child? Of course they should be there for their child. It's both genes that are present in that baby, right? And why should they be deprived of the joy of their child, or being there, of fatherhood? Fatherhood is also not such a common term. It's always motherhood, motherhood, motherhood. It puts so much of stress on one human being. Now it is nature's way that the mother gives birth and the mother has breast, so the mother is breastfeeding. But if you are able to, unburden her or be there, I always tell that, you breastfeed, but give the baby to the father for burping, that way. So in that way, the child gets to be with both, as well as the mother gets the much deserved rest. Now it is becoming more popular because now, people are talking about it. And now, uh, it people know that it's okay to, do it in open, to say it out loud, to be there for the wife. It is not going to be taken as a sign of weakness, that you're leaving your job and or doing this. You're not shouldering the responsibility. You're supposed to earn and she's supposed to take care. That scenario is changing. So that is how, we are pregnant starts right from conception to delivery to even postpartum. So being there for your baby, for your wife, right from day one, is becoming popular, because we are finally breaking the shackles of so-called, patriarchy, if that is the term. And we are normalizing that it's okay to be there for your child. I mean, I don't think this was possible for whatever reason. 15, 20 years back, people were starting up from scratch. They didn't have an option. They had to earn their living. They had maybe innumerable loans. So even one day off work would cost them. But right now, we have developed economically. People have, our quality of living has improved. People are earning better. That is exactly why people are having babies at a later age, so that they are financially, even finances are very important when you're bringing up a baby. So financially they are much more stable than what they were many years back. So that is why they can afford taking the paternity leave. We have to take that into consideration as well. So that is why it's a very good positive change, and it's awesome. But these are the reasons why it's happening, I would say.
Ma'am, now that we've talked about the role of men in pregnancy and we've come across the terms of fatherhood and motherhood and how no one is born a parent and it is a continuously evolving journey. So, how, like, are there any practices that you would suggest wherein the father particularly feels more inclusive of the whole cycle during the 9 months of pregnancy and then post delivery? How
Okay.
can a father be more, involved in everything?
Okay, so the very fact that you guys are having a baby, that itself, states that both of them have to be involved. Now, like I said, by nature, the mother is going to carry the baby, but being there for her during her antenatal appointments, making sure that you are available, being there. Many men, obviously, they opt for it, but also being there during her ultrasound scans, making things comfortable for her, like if she wants to eat, that many men do, but still ensuring that she's eating well, ensuring that she's taking care of herself, taking care of your own mental health, communicating with her every single day as to how you're feeling, how she's feeling. We hardly talk in our household, we stay with the same people, but when was the last time we went and asked our own mothers how they are feeling? Do you remember last you asked your mom, oh mom, how are you feeling? No. And it's the
Actually,
same
funny story. My mom
thing.
is not well, so I did ask her today itself.
Yeah. So why does it have to be that when they are not well, we are asking them why? How are
Yeah,
you?
exactly.
Every day, just ask how are you feeling? How was your day? Same thing holds true. Just being there makes a lot of difference, and this holds true for the husband, for the pregnant mother as well as the husband. And being there for her during her delivery. If she wants you in the room when she's in labor, be there for her. If she doesn't want you to be there when she's in labor, don't be in the room. That is also important. And post childbirth, like I said, if she's breastfeeding, be there to birth the baby. If she has expressed the breast milk, these are tiny ways, I'm just giving examples that you can be there. If she's expressed breast milk, you can take a vati spoon and feed the baby also. Many I've seen this happen, that as soon as a child is born, fathers are like, अरे alien, अरे नाजुक बच्चा गिर जाएगा, मेरे से कुछ हो जाएगा, अरे it's your बच्चा.
Yeah, it's
Yeah.
advertised also in many advertisements. Like, the mother is all, I'll take care of the baby, and the father doesn't know anything what to do,
Exactly.
is not equipped at all.
Exactly. And that is considered to be okay, but they have to learn someday. So that's what I tell, that, if the mother is breastfeeding, you hold. Abhi nahi, if you don't hold the baby, how will you know how to hold? How you're supposed to hold a baby? How you're supposed to take care of a baby? That's how you become. That's where the terminology hands-on father comes from, na?
Yeah.
Only the mother is not supposed to be hands-on. You're also supposed to be hands-on, and that is again a journey. Even you have to learn. Like I said, कोई पेट से सीख के नहीं आता ये सब करना. Every day is like, you don't. If you're giving some exam, you're not going to. I mean, most of us study one day before the exam, but otherwise you have to read every day. That's when you're going to get the first rank or whatever, get good marks. So for being good at something, you have to start slowly and gradually you learn.
Ma'am, so we've talked about the role of men and how fathers can be more involved in pregnancy, considering the fact that we currently are in India and we still live up to the concept of a joint family rather than a nuclear family, especially in rural areas and, you know, I would say smaller towns. So there are these practices of, like, a very, very common example is a Gond ka laddu and other nani dadi nuskes that we've all heard about, we've all adopted them for another things, but they are very much there during the time of pregnancy as well. So how relevant and updated are they in the present day and age? Because nowadays everything in the medical world has somewhere been westernized. So how do these nuskes fit in, and how updated are they?
See, I am a fan of dadis and nanis. So, a wise person, I don't remember who said it, but if they said that if you want to be healthy, eat like your grandmother did. You might have seen your grandmother eating like I am a South Indian, so she'll have like a tower of rice and they'll eat, and still they don't become fat. This whole concept of chawal khane se mota hota hai, or having rice or parathas with ghee, they've eaten it all their lives. They're still so active, and you'll see that they're much more healthier than we are. So these nuskhas or whatever has been there, actually they have a scientific basis to it. If you go to see, just that they couldn't explain it. Gond ka laddu, for example, or it's the edible gum laddu. It is supposed to have immunological properties. It's supposed to help in recovery. Then there is methi ka laddu. There is olive ka laddu. There is this practice of giving ghee to the mother. So these were all devised during times when women had very laborious tasks. They were doing a lot of tasks at the same time. They were delivering. They were still, after the delivery, maybe a day or two, they used to take rest, and then they used to go back to doing their routine activities, because they didn't have that whole liberty of taking the entire rest, or 40 days, whatever they were given. They were given food which was not spicy, without oil, giving 2 spoons of ghee, that is to help in their recovery, to help their immunity to come back. And majority of these, like methi is given, it is considered to be a galactobacillus, that is to increase the milk production. Most of them are given for improving the milk production. What I'd say is everything in moderation is good. So if you are being given, say, one laddu, they also have jaggery. So many mothers, craving of sweet. So jaggery is a healthier source comparatively. Or they're given khajur, all those things. So 1 or 2 laddus in a day, if you've had an uncomplicated pregnancy, if you have had a adequate weight gain, 1 or 2 laddus in a day, 1 to 2 spoons of ghee, if you've been given, it is a way of respecting or appreciating the hard work that they've put in making those laddus or things like that. But if you are overdoing it, like 4 or 5 laddus एक time पे, or having 4 or 5 spoons of ghee, anything in excess is bad. So there is nothing wrong with these practices, as long as you can, if you have a doubt or if you're doubting it, you can always cross check it with your healthcare provider, with your doctor, and then go ahead. But majority of them are harmless if done in moderation. There are obviously certain practices which is like applying kajal to the baby's eyes or putting oil into the baby's ears. Those are things which can promote infection, which I so they are obviously, because kajal now is not really pure. You never know what is there, and the baby is really delicate. The eardrum, you're putting oil into the eardrum, it can incite a fungal infection. So those practices should be avoided. So if you have a doubt, please cross check with your doctor and go ahead. But majority of them are harmless.
Yeah, so there is a rising trend of teenage pregnancies, especially in the United States of America. So, of course, having a baby while you're still a teenager bring its own sets of problem. Like, how do you finance, how do you finance it while still being a teenager? And then, especially in India, the whole society would mock you for having a baby so young. So, how do you deal with all of these problems, like when they approach you?
Okay, so teenage pregnancies are not just rampant in US, it's also rampant in India. It is, as per the National Family Health Survey 5, it's 6.8%, which in my opinion is still pretty high. And in India, why it is so is because majority the adolescent marriages are still prevalent, and we also have unmet needs of contraception. I mean, male sterilization is still as low as 0.3% in some states, because it's marred with so many myths and misconceptions when it comes to vasectomy. I don't remember ever any male coming to me and telling me that I want to undergo a sterilization, when in fact it is safer and much quicker when it comes to female sterilization. And also contraceptive choices for males are very few at present. It's only limited to condoms and vasectomy. So when it comes to teenage pregnancies, why US is in the forefront? Because of the laws that have been recently passed. That is why we are talking about it. And yes, teenage pregnancy is a taboo because it is not just financial aspect, it's emotional, mental, and society looking down upon you, and you are not mentally prepared. And when it comes to medical point of view, if you are below 18 years of age, it automatically amounts to rape. So then it becomes a medical legal case, because the legal age to have to get married or to have a child is 18. Your pelvis is not well developed, so the chances of you going in for operative delivery is higher, because your pelvis is not developed to expand and let the child pass through you. And apart from that, other consequences like fetal growth restriction, anemia are higher when it comes to a teenage pregnancy. Now, what you should do, this I want to put across, I keep putting it across on my social media page, but I also, if at all you have an accidental pregnancy, you've had accidental intercourse, you've had intercourse and you end up getting pregnant, your pregnancy test is positive. If you're below 18 years of age, please don't wait on that pregnancy. Please don't think I'll do something and the pregnancy will go away. I'll eat papaya, I'll eat XYZ, and things, the pregnancy is just going to vanish. No, please, confide in somebody you trust. It could be your parent, it could be somebody who's an adult. Take their help and go ahead and then manage the pregnancy. I have had young girls coming to me with as big as a 5-month pregnancy. not telling their parents, and then ending up, they have to be delivered then, because beyond 20 weeks, uh, now it's increased to 24 weeks, but beyond 20 weeks in India, abortion is not allowed, because the child is viable, or the child is mature enough. Okay, and if you are above 18 years of age and you have an accidental pregnancy, same thing, don't wait on a pregnancy, go and meet a healthcare provider. If you're above 18, only your consent and a witness's consent. It does not even have to be your partner. You have to just take your witness along, and an early pregnancy can be terminated medically. Please do it through the right source. Please do it with a reliable healthcare provider. Don't go to somebody whose credentials you don't know of, any random person. Don't, give your health in the hands of somebody who's not licensed or certified to take care of you. Don't make that horrible choice. It might cost you a lot. That is your life. It could cost you your life. And abortion, there are so many laws, like I just want to add to it, that they've been passed in abroad. We as a country, India is liberal when it comes to your reproductive rights, which is amazing. And a woman has the liberty to do whatever she wants with her baby. Abortion, in, like, I've read it somewhere in the guidelines, that abortion is a very degrading term. It should be a miscarriage. So if you want to go through an abortion, the choice should be yours and only yours. Like I said, even your partner's permission is not required. The consent form requires your sign and a witness's sign. So if it, don't judge yourself more than, anybody else judging you. Many times you only judge yourself that what I did was wrong. If you're not mentally prepared for carrying on with the pregnancy, please take the choice of getting an abortion as quickly as possible and go and meet your healthcare provider.
Ma'am, so with whatever we've talked about abortion and all that, so we can say that nowadays the anti-abortion laws that are being passed around the globe, they somewhere cage women in a very subjective interpretation of the term.
Of course, I mean, who are you to decide what she wants to do with the pregnancy? How can you decide? How can there be a law for
That is true.
something that is so personal? It's like me coming and telling you, Arav, you cannot take this injection. There is no law for you to take this injection. You can't do this. You can't get that tattoo because there is no law. Because this law says you can't get that tattoo. I mean, how can I decide what you want to do with your body?
That is true. Okay, with that, we've come to an end with conversation with Dr. Shetty. Thank you so much, ma'am, for taking your time to chat with us. I hope that a lot of individuals hear what you said and talked about today and are now well aware of everything about pregnancy. Again, thank you so much for talking to us.
Thank you so much for
Seriously.
having me. I'm
Yeah,
glad.
thank you so much for apprising us with your knowledge. We would also like to extend a gratitude to our listeners for tuning into this podcast. And I hope that this was just as informative and enlightening for you all as it was for us. Thank you so much, ma'am. It really was amazing to meet you.
Amazing day and year ahead.